Delirium tremens is a condition which arises after the alcohol withdrawal or after the intoxication of the alcohol. So such a condition is basically regarded as a psychiatric emergency, and one should know how to basically diagnose such a condition. Obviously, the history taking again is very important over here. The collateral history is again very important over here, just to get the knowledge if the patient has been taking the alcohol or not. So these are the symptoms that revolve around the delirium tremens or the patients who are suffering from delirium tremens. So over here in this section, first of all, we'll be discussing the clinical manifestations of such people who are suffering from delirium tremens. What is the range of symptoms that basically revolve around such individuals? And then finally, we'll be discussing the risk factors. Basically, a lot of people take alcohol, but still they do not get into this condition which is known as delirium tremens. So there has to be some risk factors which makes the person more prone to developing this kind of a condition which is known as delirium tremens. Then again, the risk factors will be discussed over here in this section. And finally, we'll be discussing the management plans for such individuals. What are the treatment modalities that we inculcate in such individuals who are suffering from delirium tremens? Obviously, the treatment modalities range from the cognitive behavioral therapies, giving the insight to the patient and to the relatives or to the close friends, and as well as the pharmacotherapies are sometimes coupled with the cognitive behavioral therapies. So defining delirium tremens, it's basically a confusional state that is caused by the withdrawal of alcohol, and it occurs in 5 to 10% of the patients. So this confusional state, it can range it can range in the severity from mild, moderate to a severe confusional state, and it depends upon the individual how prone he is to developing such delirium tremens. Basically, the signs and symptoms include the clouding of the consciousness, which gets worse at night. And then he may also give you a history of hallucinations or illusions. When we talk about hallucinations, it can basically variate from the auditory, tactile hallucinations, or even the visual kind of hallucinations. And illusions can sometimes be observed by the individual as well. Then tremors, again, the tremors can range from the fine tremors, or it can be the motor tremors, which can hinder the daily activities of the individual. Then the secondary delusions, that is basically the delusions of paranoia, then agitations, and then insomnia. These sleep-wake patterns, these sleep cycles are going to be seem to be disturbed in these individuals who are suffering from delirium tremens. Seizures are sometimes observed in a lot of individuals. So the symptomatology is quite simple. It's basically the passage of the alcohol to the blood-brain barrier that is causing these range of symptoms, which is basically ranging from the illusions, delusions, hallucinations, and even finally these seizures can be observed in such individuals. The clinical manifestations or the symptomatology can relate when we examine such individuals. Pupil dilatation is observed in a lot of individuals. Then pyrexia is one of the side effects. Tachycardia is observed. Signs of vernix encephalopathy is observed in a lot of individuals. Along with that, a raised blood pressure is observed in a lot of individuals. Hypohidrosis is observed, and then we have dehydration. So all of these signs and symptoms are observed in a lot of individuals, including a kind of a neuroleptic malignant syndrome that is basically characterized by the pyrexia, a raised heart rate that is basically the tachycardia, dehydration, and the circulatory collapse and death. All of these symptomatologies are going to be observed in these particular individuals. Obviously, the detailed physical examination, the general physical examination, as well as the systemic examination is required in such individuals. When we talk about the delirium tremens factors, the risk history of the sustained drinking has to be taken in detail. The previous delirium tremens or at the old age, the presence of the other illnesses, All of these are the risk factors, and they basically make the patient more prone to developing delirium tremens. There is a greater mortality risk, and patients who are elderly, concomitant lung disease, core body temperature is more than 104 degrees Fahrenheit, and then obviously the coexisting liver diseases. So these are the factors that are seen in the delirium tremens in a lot of individuals, and that make the person more prone or at risk of developing delirium tremens. The management basically includes acute medical unit. The drugs that are commonly given in such condition are the chlordiazepoxide benzodiazepines. The dosages are usually 20 to 40 milligrams every 4 to 6 hours to prevent epilepsy, of course. The symptoms reduce after 5 to 10 days. So this is basically the pharmacotherapy that is given for such individuals suffering from delirium tremens. When we are basically suggesting the pharmacotherapy, it's basically benzodiazepines and chlordiazepoxide. Along with that, the fluid imbalance has to be treated. It requires monitoring. It requires thiamine deficiency monitoring as well. The investigations include the CBCs, that is basically the complete blood count. Then we have the LFTs, that is the liver function test, the urea creatinine, the electrolytes, and the ECGs are performed on these individuals. Poor diet malabsorption is treated. Vitamin C is given orally for such individuals, whether it is given orally or it is given parenterally as well. So it's basically the summarization of the treatment modalities that are usually inculcated for such individuals suffering from delirium tremens. When we have a look at it, it's basically a combination of pharmacotherapy, a combination of fluid imbalances, and then a combination of a complete monitoring techniques as well. The complications would usually include the subdural hematomas, and along with that, the impaired clotting factors. Again, the causative factors over here is the passage of the alcohol through the blood-brain barrier. It's again very important over here. Then the hepatic effects of the alcohol. So the alcohol has a range of hepatic effects, and it can result in a fatty liver. It can result in the chronic cirrhosis of the liver even. So all of these effects of the alcohol on the liver are again very important, and that is why a complete monitoring with the CBCs along with the LFTs, the urea creatinine, and the electrolytes is given from time to time for such individuals. So in this section, basically, we dealt with the delirium tremens, which is basically a condition that arises after the withdrawal of the alcohol, how the patient presents in the emergency departments with such a withdrawal symptom, how can we treat these patients, and how can we inculcate the cognitive behavioral therapy, giving the insight to the patient that how he is basically more prone to developing this delirium tremens, and along with that, the complete monitoring of the patient is also inculcated for the complete ailment of delirium tremens. So that is the end to this section. Thank you for watching sqadia.com.